Imagine being told you have exactly 12 minutes to save someone's life. Not with surgery, not with medication, but with something doctors said was impossible. This is the true story of Sarah Mitchell, an ICU nurse who broke every rule in the book and changed medicine forever. What she did in those 12 minutes still has doctors shaking their heads in disbelief. It was 2:47 a.m. on a Tuesday in Seattle Grace Hospital. Sarah Mitchell had been an ICU nurse for 23 years, and she'd seen just about everything. But nothing prepared her for what walked through those doors that night. A 16-year-old boy named Marcus Davis was rushed in, completely unresponsive. He collapsed at basketball practice. The diagnosis came fast and brutal: sudden cardiac arrest with severe brain oxygen deprivation. The doctors worked frantically, but after stabilizing his heart, they delivered the crushing news to his parents. Dr. Peterson, the chief neurologist, spoke in that careful, practice tone doctors use when hope is gone. "We've done everything we can. His brain activity is minimal. Even if he survives, the damage is catastrophic." "I'm so sorry." Marcus's mother, Jennifer, collapsed into her husband's arms. Their only son, a straight-A student with a basketball scholarship to Duke, was effectively gone, but Sarah couldn't accept it. She'd watched Marcus's parents in the waiting room for hours. She'd seen the photos on Jennifer's phone: Marcus volunteering at the animal shelter, goofing around with his younger sister, crossing the finish line at his first marathon. This wasn't just another patient. This was somebody's whole world. At 6:15 a.m., Sarah did something that could have cost her career. She walked into Marcus's room, closed the door, and pulled up a chair next to his bed. The machines beeped their steady rhythm. His chest rose and fell with the ventilator's mechanical breath. "Marcus," she said softly, taking his hand, "I don't know if you can hear me, but I need you to listen." The other nurses thought she'd lost it. The doctors had written him off. But Sarah had read something in a medical journal 3 weeks earlier, a small study from Norway about unresponsive patients and familiar voices. It was controversial, unproven, dismissed by most of the medical community. She didn't care. "Your mom is in the waiting room right now," Sarah continued, her voice steady and warm. "She's wearing that ridiculous Duke sweatshirt you bought her. Your dad keeps pacing back and forth. And Marcus, your little sister Emily, she made you a get-well card with glitter. There's glitter absolutely everywhere." Nothing. No response. Just a monotonous beep of the heart monitor. Sarah glanced at the clock. She'd give herself 12 minutes. If nothing happened, she'd stop. She'd accept reality like everyone else. "You know what your mom told me?" Sarah said, squeezing his hand gently. "She said your first word wasn't mama or dada. It was ball. You've been obsessed with basketball since you could walk. She said you used to sleep with a basketball instead of a teddy bear." Still nothing. 7 minutes in, Sarah's voice started to crack. "There's a whole waiting room full of your teammates out there, Marcus. Coach Williams has been here all night. Your girlfriend Jasmine brought you your favorite candy, those sour gummy worms you're always eating." The machines continued their indifferent symphony. "Marcus, I need you to fight." Sarah's professional composure was crumbling. "I know you're in there. I know you're scared. But your family needs you. The world needs you." 11 minutes. Sarah took a deep breath, preparing to give up. Then she remembered something Jennifer had mentioned. She leaned in close. "Hey, Marcus, your mom told me something else. She said whenever you're stressed before a big game, she tells you the same thing. She says, 'You've got this, baby.'" Showed him what Davis' determination looks like. At exactly 11 minutes and 43 seconds, something impossible happened. Marcus's finger twitched. Sarah's heart stopped. She stared at his hand, convinced she'd imagined it. Then it happened again. A small, deliberate movement. "Marcus?" she whispered. His eyelids fluttered. Sarah's hand shook as she pressed the call button. "I need Dr. Peterson in here now." Within seconds, the room flooded with medical staff. Dr. Peterson rushed to Marcus's bedside, checking his vitals, his pupils, running every test imaginable. Marcus's eyes opened slowly, unfocused but undeniably aware. "That's impossible," Dr. Peterson murmured, checking the brain activity monitors. "His neural responses, they're increasing rapidly." Over the next hour, Marcus began responding to commands, squeezing hands, following objects with his eyes. By that afternoon, he whispered his first word, "Mom." 3 months later, Marcus walked out of that hospital, not in a wheelchair, on his own 2 feet. His recovery wasn't just unlikely. According to every medical textbook, it was impossible. Dr. Peterson conducted a full study on what happened. He discovered that Sarah's intervention during that critical window, speaking to Marcus with specific personal details, familiar voices, emotional anchors, had created a bridge. Her words had given his brain something to fight for, something to reconnect to. The medical journal published their findings. It's now standard protocol in many ICUs, the 12-minute connection protocol, named after Sarah's intervention. But here's what really matters. Sarah didn't have special powers. She didn't have breakthrough technology. She had something more powerful. She refused to give up on someone when everyone else had. She saw Marcus not as a lost cause, but as a human being worth fighting for. Sometimes the most powerful medicine isn't found in a prescription or a procedure. It's found in refusing to accept that hope is lost. It's found in those moments when we choose to show up, speak up, and hold on when everyone else has let go. We all face moments when giving up seems like the only logical choice. When the odds are impossible. When the experts have spoken. But Sarah's story reminds us, sometimes the most extraordinary outcomes happen when ordinary people do something extraordinary. They refuse to quit on what matters. Marcus is now 19. He's playing basketball at Duke, just like he dreamed. And somewhere in Seattle, Sarah Mitchell is still working the night shift, still holding hands, still refusing to give up. If this story touched your soul, hit that like button. Share it with someone who needs to hear it today. And subscribe to Soul Relief Stories for more inspiring true stories that remind us what really matters. What's one moment when someone refused to give up on you? Share in the comments below. Thanks for watching. Keep believing in impossible things.